views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hi, and welcome to Open BXRx, BronxNet special coverage providing you the latest information, resources, services, and community efforts taking place locally here in the Bronx and virtually during the pandemic. I'm your host, Sonyi Lopez, and today is Tuesday, December 8th. Coming up, we'll learn more about Montefiore and Albert-Einstein College of Medicine's new COVID-19 vaccine unit. We'll also share how you can be part of trials. Then, a Bronx nurse joins us to share her experience working through COVID-19 at New York City Health and Hospital's Lincoln Hospital. After that, we'll chat with a teacher from East Harlem Scholars Academy to learn how the charter school experience has been different from that of the public schools through remote learning and more. And Mobilization for Justice joins us to discuss tenant rights and the first tenant eviction since the beginning of the pandemic. So please stick around. Open BXRx starts now. Welcome to Open BXRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. Montefiore Health System and Albert Einstein College of Medicine recently opened the doors to a new COVID-19 vaccine unit, which will enroll people in clinical trials that will test the efficacy of vaccines against the novel coronavirus. Joining us now is leading doctor of the COVID-19 vaccine unit, Dr. Barry Zingman. Welcome, Dr. Zingman. Thank you so much for joining us today.
Thank you for having me.
Of course. And to start, can you please tell us more about Montefiore and Einstein's new COVID-19 vaccine unit?
Sure. As the pandemic was developing in the spring, we knew that we would be moving quickly from an era of emergency therapeutics, emergency treatments for people severely ill with COVID-19 to dealing with the pandemic on a societal basis. And so we began preparing for the inevitable vaccines that were going to be coming out so that we could begin to offer them to people of the Bronx. And new vaccines like this always start with clinical trials. So these are studies that are progressively larger and larger. And we started preparing in around May or June to create a new ambulatory outpatient research area where we could handle a high volume of people that would be needed to be in these trials of vaccines. And so that has come to fruition over the summer and into the fall, just in time for those vaccine trials to be coming out.
How and where are vaccines being administered, and how are many people have enrolled so far for the vaccine trial?
So we are enrolling patients into the vaccine trials at the Moses Division of Montefiore Medical Center. So that's the campus of Montefiore that's on Gun Hill Road and East 210th Street. We have an ambulatory building there where we already do clinical trials, and now we expanded the area to add more exam rooms, add more staff, add a laboratory and an area to store the medications. So it's right in the Gun Hill Road section of the Bronx.
And Dr. Zingman, why is it important that the majority of vaccine trial participants be people of color and individuals older than 65? I read that in the press release about this new vaccine unit.
Yeah, we focused on the populations most affected by COVID-19 from the very beginning. So we know that people of color, particularly Blacks or African Americans, are particularly affected by COVID-19, Latinx as well, and particularly Black African Americans die at a higher rate than others with COVID-19. In addition, healthcare workers are very affected by COVID-19 due to exposure, potentially at work when they don't know that somebody's has COVID. and people over the age of 65, if they get COVID, can have a very high mortality rate, approaching 1 out of 3 mortality rate if you're 80 or over. So we knew that from the very beginning that we would have to focus our efforts at bringing these communities into the trials. And there's 2 reasons to be able to do this. One is that these are the communities that need the vaccines the most. So by entering into trials, you're given access to vaccines earlier than you might have been otherwise. The second thing is the societal reason. And we know that if people in the communities most affected by COVID don't themselves take part in the clinical trials of these vaccines, when the vaccines actually are approved and released and available, then the people most at risk for contracting this, most at risk for dying from COVID-19, may not take it at all. So we have to be able to prove that the vaccine works in these communities and that it's safe in people from these communities. And so that's what we've planned since the beginning. And what I can say is that the vaccine trial that we're doing right now has been open for 2 weeks. And in that time, we've enrolled 60 people as of this afternoon. And more than half have been people of color or over 65. And in fact, some people are people of color over 65 and healthcare workers too. All three in one. And that's wonderful. But we've had a fantastic response from the community. We've, as I said, 60 people have actually enrolled and gotten the first dose of the vaccine study. But we also have about 200 more volunteers that we are talking to and screening to see if they're eligible, making sure that they know everything they need to know before starting in the trial. So it's been fantastic. The response from the community has been wonderful, and we've been reaching into the Montefiore community as well as outside of the Montefiore community. So we have been on the streets, we've been going to churches, we've been going to community boards, we've been sending out flyers and word of mouth, and people have been bringing in their families and their friends. We've had a number of families come in, couples come in, partners come in, and that's been wonderful. People have been doing it as a group activity, and that's fantastic.
That sounds fantastic. I wanted to learn more about the particular vaccine that Montefiore and Einstein are using. It's called the AstraZeneca Oxford vaccine. Why did Montefiore and Einstein believe that this is the right vaccine for this trial, Doctor?
So as you may know, there are literally dozens of vaccines being tested around the world. And we have chosen to go with some of the ones that look most promising. And there were 2 vaccines that started their trials early in the summer when we weren't ready yet to be able to offer it. The AstraZeneca University of Oxford vaccine is the one that we're doing right now. The information that we have in favor of it is tremendous. There have been over 10,000 people who have already gotten the vaccine, and it's showing very good effectiveness so far in these preliminary studies so far that are getting larger and larger by the day and going on all around the world. And the side effects have been very tolerable. So it was a very promising vaccine from the very beginning in the spring when it was developed. And so we were very pleased to be able to offer it.
One thing I wanted to ask, Doctor, was that this same vaccine has been tested in the past. However, due to a mistake by a contractor, volunteers only received half dose of the vaccine. How has Montefiore and their physicians and scientists prepared to ensure the efficacy of this vaccine in particular?
Sure, absolutely. So let me just start back a few months ago when the trials were starting up very quickly. And as your audience would know, we've needed to respond as an emergency for everything regarding COVID-19. Everything has been an emergency. Everything has to happen yesterday to be able to be ready for people when they need it. And there are actually multiple trials of this vaccine going on around the world, separate trials of 5 to 10 to 20 to 40,000 people in different studies around the world being tested in different populations, in different settings, and among different nationalities, race and ethnicities. So there are different trials going on all over the world. The very first large one started in the United Kingdom. And it turned out that first week that they started it, unfortunately, they miscalculated how much virus was in the shot, and within 1 week they realized that they had made a mistake on that. And ever since then, they've been giving the full dose. Ever since then, to everybody all around the world, people get a full dose of the vaccine at the first day, a full dose again 4 weeks later. But because of this mistake, people had already gotten vaccinated with it. They decided to look at the results. How do people do if they got a half dose for the first time? So it was about 2,000 people who got a half dose. Everybody else in the 10 to 15,000 who've gotten it since then have gotten the full dose. The 2,000 people is actually as vaccines go, it's a very small number. And in that small number, the vaccine looked really good. It had over 90% effectiveness.
Ah.
Now we've seen effectiveness like that in other studies of this vaccine so far. But last week, they also released results from another study in Brazil. And in that study from Brazil, where they were testing for COVID in a very different way than we're doing, and in a very different way than the Pfizer and Moderna vaccine is doing. They were actually testing people every single week, no matter whether they had symptoms or not. So they were going to find a lot more COVID in that clinical trial. In that clinical trial, the effectiveness of the vaccine was about 62%, 62 out of 100. And so unfortunately, we really can't compare the different studies because they're not testing people in the same way. And in the study and the Pfizer and Moderna vaccines that reported about a 95% effectiveness, they all still tested in a different way. So this is some of the differences, and this is actually pretty complicated. I understand that if you test differently for COVID, you may find it either more or less, depending on how you've actually designed that particular study. So the study that's going on in the United States is 40,000 people. As of Friday, 13,000 people have already enrolled, and people are being diagnosed with COVID if it happens during the study, like with the Pfizer and Moderna vaccines. And so we're expecting a very high rate of success, like has been seen in the AstraZeneca trials elsewhere. But we don't know for sure yet. We have to do these tests. We have to do these tests in large populations of people to be sure that they are safe and effective. And let me just add another point of it, is that we don't only need to know how well a vaccine is working in the first month or two, like with the results we have right now with the Pfizer and Moderna vaccines. They've gone to the FDA with that, and they're going to be voted on later this month. But we really need to know whether or not the vaccines work over time. We need to know that they're going to still be working at 6 months and 12 months and 2 years and 5 years, and whether or not people need a booster or other ways to be protected against COVID-19. So that's why it's really important to be doing these studies, to be doing studies of multiple different vaccines, because some end up being better than others, and they're in multiple different ways.
Dr. Zingman, what are the different ways in which this trial is measuring the success of this particular vaccine?
We're actually looking for success in 3 different ways, 3 different main ways. One is, do people develop less COVID-19? Okay, that's one very important way. Second, if people do develop COVID-19, is it less severe? Because does it prevent people from dying from COVID-19? Does it prevent people from being hospitalized with COVID-19? That is a critically important outcome that we hope to see. And the third is, do people develop blood tests that show that they're likely immune to the virus? So those are the three main ways. And so far, we are seeing all three with the AstraZeneca vaccine and some of the other ones that are starting to come out.
Thank you, Dr. Zingman. Before we go, if someone's tuning in and they're interested in having more information on the vaccine trials that are happening here in the Bronx, can you just provide a number or contact information for folks to call and find out more information?
Oh, thank you so much for asking. We would be really happy if people contacted us to learn more about the vaccine trial. It's completely voluntary, and you could either call 718-920-2229, or you can email us covidvaccine@montefiore.org. That's COVID vaccine at montefiore.org. And we're getting about 20 or 30 volunteers a day and screening them. It's been wonderful, and we're looking for more people.
Thank you, Dr. Zingman. Thank you again for your time today.
Thank you so much.
We'll be right back with Open BXRx.
We know that people are dealing with the health crisis, but there's also a lot of food insecurity.
We're giving out healthy food options, and that's what's key here.
If you're a senior, you have a disability, they'll actually deliver meals to you.
The residents are anxious, they're worried, they're scared, they want to be tested.
When things were happening in our community and we couldn't get the help.
There's almost a presumption of criminality that attaches to your skin color.
The site will prioritize those who are at highest risk in the population.
If you feel symptoms and you'd like to visit one of these COVID-19 testing sites here in the Bronx, you may call the State Health Department's hotline.
Important to note about this site is no reservations are needed. This is a walk-in clinic.
A lot of us are out of work and looking for something to do.
We have the machinery and the skills to make large scales of these masks and gowns.
Take care of your people. It's going to go way further than we actually can understand.
Right now, employees like myself are just adjusting to the new reality.
Reporting from BronxNet, welcome back. According to recent data from the New York City Department of Health, the 10455 zip code in the Bronx, where Lincoln Hospital is located, has the highest 7-day % positive rate for the deadly virus at 7.61%. Nurses and doctors are now preparing for a possible second wave of surging cases in the area. Joining us now to share more about their personal experience as a nurse during COVID-19 in the Bronx is nurse Narelia Oliveras-Arzuaga. Narelia, thank you again for coming on. You came on a couple of months ago. How are you? How have things been going since then?
Well, I think we're learning to be adaptable in this situation because things have changed and things are continuing to change. So I think that for the most part, I've just been, taking it day by day and, just trying to be as informed as possible, and trying to share whatever information I have so that I can be of service, to the community at a higher level than just one-on-one with my patients.
Right. And how have you been dealing with the sudden rise in cases that are coming through? How have healthcare workers and you as a nurse been dealing with that?
That's a great question. I think that everyone is, coping as best they can, I have to say. I think that we haven't really seen such an increase where we are feeling the way we were feeling before back in March, April, and May. But I think there's like small little whispers, we're talking around the hospital, like, do we have enough supplies? What's going to happen really after this Thanksgiving holiday, I think is the question on everyone's mind right now. As nurses, we're really paying attention to what's happening, watching the news. So we heard something like 6 million people traveled over this holiday break. And I think that as much as we understand the need emotionally to be there with your loved ones, we also understand that we've had 4 million newly infected people this past November alone. So we understand the situation is dire right now. And a lot of us are continuing to make sacrifices, like not seeing our own family members, because we know that we have to be, we have to be an example, and we also have to keep our own loved ones safe. We would be really irresponsible of us not to do that. So it's a lot, and it's a lot, but we're just aware, keeping track of what's happening, and slowly mentally starting to prepare for what could be this peak in the second wave.
Absolutely. And I think that's something I actually wanted to mention. So I'm glad that you mentioned the Thanksgiving holiday and how many people traveled. You said 4 million cases started surging in November.
Yes, we've had an increase of 4 million cases nationwide in this month alone. We're at 11 something, almost 12 million, if we haven't reached the 12 million person infected mark in the United States, and 4 million. So a third of those cases have just happened within the last month. We can think about it that way.
And how can we avoid this from repeating itself when Christmas comes along? A lot of families like to get together, especially, Hispanic. I know my family loves to get together, but it's not the same this year. Personally, my family didn't do anything this year for Thanksgiving, but everybody stood in their little, pods, in their little circles. So what would you say to families who are thinking and considering going to get together for Christmas season?
I would say that I understand the desire to want to be there. And in some cases, people need to take calculated risk. If it's the last Thanksgiving that you may have, with a loved one, you may choose to say, I'm going to take this chance. But, we've been looking now, thankfully, the CDC has been able to provide more guidelines now with this change in the administration that is, happening now. And so we have a resurgence of the CDC as our leader, as our public health expert. And we should definitely adhere to CDC guidelines. And the CDC guidelines are saying that you should not celebrate with people that are not in your immediate household. And as difficult as that is, I think we need to stick by that, because if we don't, our family members we may not be there to celebrate, or our family members may not be there to celebrate next Christmas with us. So do you sacrifice the end of a terrible year and look for towards the future? Or do you say, I'm going to take this chance, and then who knows what's going to happen, January, February. We want this to end.
Yes.
We're all looking forward to this ending. So we have to do our part, as difficult as that may be.
Yes, it is difficult, but it's definitely necessary. And thank you for sharing, more on that. Narelia, what would you say has been the toughest part of your job as a nurse throughout this pandemic?
I think I go back to what I said before, where, not being able to help people, get better is something that I think all of us in the medical community struggle with, because we are taught to, to heal, to help. And I think this feeling of, where you feel kind of like futile, like there's nothing more that you can do. I think when it reaches that level, when patients are severely ill and in the ICU, I think that's probably the biggest strain on nurses and doctors, because you're doing so much. You're consistently working, consistently giving medication, giving treatments, doing a whole bunch of things. And to know in the end that it's not going to be the outcome that you want it to be is really difficult and frustrating. And, in the nursing community, there's talk of people not returning to nursing in the following years. And nursing has been such a booming, profession, and such a, just, it's noted, it's well respected. It's, people think of nurses as like, heroes, but the truth is that you're a person, you're a regular person, and you consider it just doing your job. And seeing people consistently be really ill and away from their family members and die that way is something that it's indescribable, and it just goes against everything that we know and we feel inside. So I think all of us have a little bit of like PTSD from all of this in a way. It's difficult.
Yeah. I can imagine, and I can just say thank you to you and so many other essential workers who have put their lives on the line throughout all this, this entire pandemic. It's been months now, and here we are still, combating this virus and trying to just, like you said, provide information. As a healthcare worker, you're here joining us outside of work hours to help people understand, like this is a serious thing and we should all be taking care of each other. So thank you for the work that you've been doing, and don't feel bad, like even if you are a healthcare worker and sometimes it feels like you're being defeated because of the work and how people are passing away, you're doing your best. So thank you, and thank you to your colleagues as well.
Absolutely. Thank you for saying that. I was just thinking that, we have to look out for each other, and do our own like self-care type of things. I actually did travel. I was actually away in Chicago for 5 days.
Oh, wow.
I know that was a little bit risky. I, of course, made sure to always have my mask on and always be really well protected. And I avoided crowds and things like that. It wasn't like there was a lot of those type of activities that were going on. But we do need, to take care of ourselves. And it was a really restorative trip. And I kind of want to see what it was like to fly during the pandemic and just see like, okay, I flew during the pandemic, but I was also kind of scared. I actually came back and I had a little cough and I was like, oh my gosh, I instantly regretted it. I was like, no, what did I do? But no, it was a great trip. It was amazing. And the point is that we as healthcare workers need, we need to take care of ourselves as well and recognize that when we need someone to take care of us, because that may happen as well. And that's real. It's hard to ask. We don't normally ask for help. We nurses, we're the worst patients. We're never sick, according to us. But yeah, we also need to do what we have to do for ourselves so that we can continue to care for patients and give them the highest level of care. Because when we are spent, mentally and physically, it's really difficult to do that.
Very true. Like you said, you're people too, so you need, self-care as well. We've heard, Narelia, from the CDC and the city that everyone should get tested, and getting tested more than once is actually something that's been being pushed as well. Can you share why this is important right now?
Absolutely. So being that we're so far into the, this pandemic, we've had time to develop different types of tests. And so there's different types of tests that are appropriate for different situations. So everyone get tested, yes, but also know the level of risk that you have. So there's a rapid test, which just detects like if there is a copy of the virus. It's usually done via like a nasal swab. Some people say the COVID test, it hurts or it's uncomfortable. Yes, there's one that they do in the front of the nose. That one doesn't hurt at all, and that's usually that's a rapid test. It's a basic screening is what it is. And the results the nice thing about it is that results come back quickly. Sometimes, as some people I've heard say, my research said it's close to 15 minutes. I personally haven't seen that at the hospital. The fastest one I've seen takes about an hour. But the flip side of that, of course, is that these tests are not as accurate, and some people have gotten false negatives. So that false negative may embolden someone to say, hey, I don't need a mask, or I can be around other people, and they unknowingly may be spreading the virus. So my research recently was showing me that small gatherings are actually the largest spreader of COVID-19 right now in New York. Obviously, we can't do big gatherings, but there's like a false sense of security. Like, okay, if I have less than 10 people in my house, I'm okay. And the truth is that the way things are going now with 4 million cases last month, that's not necessarily true. So the false positive may give people that sense of security. And so that's not always an appropriate test. For us, big healthcare workers, we do a test it's called a PCR test. And basically that test is also done by a swab, but it goes a little bit higher into the nasal cavity. And that test usually takes about 5 to 7 days to result, but it's a much better indicator of actual disease. So those are the two main tests right now, rapid antigen testing and PCR testing. Again, depending on your level of risk, you should speak it with your healthcare provider, and they should ask you questions about your level of risk and then determine which type of test is most appropriate for you.
Thanks for clearing that up for us, because I know a lot of people may be taking the wrong test, like you said, and getting the false positive or the false negative. And
Right.
you want to ensure that they are taking the correct test depending on their contact, I guess, right?
Of course, of course. I mean, if you're someone who really has been working from home, really has not gone out, has always had on their mask, and has not been near anyone that is sick, a rapid test may be perfectly fine for you. If you are a healthcare worker, if you have been around people that have confirmed disease, those are different situations, and you may want to do the PCR test for that. I've only had the PCR test done. I actually would say that I wouldn't trust a rapid result, not for myself that has such a high level of risk, at least. It's better to wait for results and quarantine while you wait, but just make sure that result is the most accurate one. And there's no reason why you can't retest. I've been tested 4 times, and I definitely was tested after travel, immediately after travel, and then I repeated my test 3 days later, which was the latest recommendation from our governor, Andrew Cuomo. So if you travel, make sure that you get a test as soon as you come back, and then take another test 3 to 4 days later, so you can have confirmatory testing. There's nothing wrong with retesting. It's probably the safest bet to make sure that you have accurate results nowadays.
Got it. Thank you, Narelia. And before we go, how can people get tested at Lincoln? How quick is it? And what do they need? And is it free to get tested?
Those are awesome questions. So I know that people can get tested at Lincoln. This is actually something new that Health and Hospitals Corporation has been implementing at the hospital. So it's testing that's available to the public. I actually, because I'm on the unit, I haven't really gotten a lot of information about the program, but I know that there's plenty of people that are at Lincoln right at the front, and they're able to guide you. Everyone who comes into the hospital must wear a mask, must have their temperature checked, and just state that you're coming to Lincoln to get a COVID test, and they will direct you. There's lines, so that is very organized from what I've seen, and it's done in the lobby, so it's a pretty spacious area. There's lines, so that you have to wait, you register, and then you wait, and then I believe someone takes you to a room in the back. There may be one other person getting tested, but they'll be 6 feet from you. And then I'm not sure how long those results take. You would need to speak to whoever's doing your test to find out.
Thank you again, Nurse Narelia, for joining us today.
Not a problem, Sonyi. Take care. It's a pleasure to be with you guys.
Well, pleasure to be with you as well. Take care, and thank you so much for your work and for the work of the nurses that you work with throughout this pandemic.
Always. It's a pleasure to serve. Take care.
NYC Health and Hospitals Lincoln, located at 234 East 149th Street, offers COVID testing and antibody testing Monday through Friday, 9 a.m. to 6 p.m., and Saturday through Sunday, 9 a.m. to 4 p.m. You can call 718-579-5000 for more information. And for more free testing locations near you, you can text COVID tests to 85548. Continue to wear a face mask, keep 6 feet apart, and be safe. We'll be right back. Welcome back. Back in March, one of the first schools to fully launch and implement virtual learning was East Harlem Scholars Academies. The leadership in the community-based academies made the decision to close their doors on Friday, March 13th, and they've continued remote teaching ever since. Joining us now to share more about her experience at East Harlem Scholars Academy this second is teacher Emma Sprecher. Emma, thank you so much for joining us today.
Thank you so much for having me.
Of course. So to start, can you just tell us a little bit more about the academy that you work in, East Harlem Scholars Academy II, and what types of students you serve at that school?
East Harlem Scholars Academy is a state charter. It originally started in 1958 as a tutoring program to just boost academics in the community. As it grew, it turned into an after-school program that serviced mainly DOE schools. Then it sort of created its own network of schools. So we have 2 elementary schools. I work at the second one, Scholars Academy 2. We have 2 middle schools, and we have 1 high school, which is actually in its first couple years of being in existence, which is awesome for a network that is growing within the community. Our network also has a huge emphasis on abolitionist teaching as a way to use their anti-racist practices to shed light on institutional racism and all the other isms that plague communities around our world and our country. And that sort of brings me into the students that we serve. So we mainly serve students of color from all different cultures and backgrounds that are in the East Harlem community. So that being said, that doesn't mean that all of them are from East Harlem, but the majority of our families come from East Harlem community. And if you walk anywhere in East Harlem community, you'll probably see one of our buildings because they're everywhere. One of them is really big and blue, and you really can't miss it.
Thank you so much, Emma, for providing that background. And I wanted to ask, do charter schools operate under the same regulations and protocols that public schools receive from the governor and the mayor? How did charters and public schools operate differently during the pandemic?
Yeah, so because our charter is a state charter, we are still under Cuomo, but in terms of de Blasio, we have a little more flexibility. I think a really good example of that was when we originally closed. We closed weeks or a week earlier than public schools had decided to close. On top of that, another really good example is this week. So before de Blasio had decided right before Thanksgiving that he was going to shut down schools, we had already proactively made the decision that due to holiday travel and just, large gatherings during this time of year, we were going to pause hybrid learning for these 3 weeks in between Thanksgiving and the New Year, just to, prevent anybody from coming in that might have been at these gatherings or might have traveled, staff, students, anybody. And then that gives us time after the New Year for everyone to get tested and come back and have a fresh start and resume hybrid learning.
Got it. So how has your experience been as a charter school teacher? How did you and your colleagues begin to transition with your students for remote learning? Were there any challenges?
So to start it off, I'm only a second-year teacher, which means that last year was my first year, and in March of last year, they told us to go home. So I've never completed a full year as a teacher in the building. So going into a professional career, you always have these expectations, and then it kind of just blew up in all of our faces. And I think that being a teacher right now is just redefining what that means. So when they told us to go home on that day, it was definitely very scary and confusing. We didn't really have a plan. We only knew that we were going home and we didn't know when we were coming back. And I remember the day so vividly because the kids were there and we got a notification around lunchtime that we were going home. And not only were we going home, but we had to send the kids with 3 weeks worth of work. And any teacher will say they're prepared. We're prepared 2 weeks out. We know we're teaching in 2 weeks, but nobody's prepared for 3 weeks. So in 2 hours, we had to put together all of the material to send home with our kids so that they had hard copies. And it was just such a team effort, and everyone was nervous with everything going on in the world, but also then having to put it all together. And if you've ever been in a school, the printers never work. So there was just this need to get things done, but we did it and we sent it home, which also gave us the ability to just start right from where we had paused the next Monday. So within that Monday, we were continuing academics, we were continuing learning. We didn't miss a beat. There was no waiting around and deciding what we were going to do. Our leadership had a plan, and it just all happened so quickly. Those first couple of days were very stressful, but when we got through it and got a routine, it definitely worked. So.
Emma, how about the students? Did any of your students face challenges with lack of access to tech or internet? With everything happening with the disparities and tech equity, lack of tech equity in the Bronx and in Manhattan as well. How did the students find that to be challenging?
Well, yeah, and I think that we all know that COVID itself has shed a light on a lot of these inequalities that, a lot of people didn't know about in the beginning. So right from the start, we knew that lots of our families needed tech. They not only needed tech, but they needed Wi-Fi. So right before we went home in March, surveys were sent out to our families, basically get an idea of how many computers we needed or how many Wi-Fi adapters we needed. So within those first couple of days of virtual learning, we gave out so many computers. I don't have the specific data, but I was fielding those emails, so I know it was a lot. And so that happened in the first wave. So we were sending out Chromebooks, we were sending out Wi-Fi enabled iPads. And then as COVID has sort of continued and this whole virtual world has expanded, it's not possible anymore for there to just be one computer in the house or two computers in the house. Now you need your 10-year-old to have a computer, your 6-year-old to have a computer, and sometimes even your 4-year-old to have a computer. So that's a lot of tech. So we have constantly been receiving orders, and as fast as we get them, we give them out. Sometimes it does take a couple weeks, but we try to get them out as soon as we're able to get them.
Are there any plans to reopen the school, the physical locations of the academies anytime soon?
Yeah, so we have a reopening plan that's based on family collaboration, based on what our leadership deems appropriate, and based on just basic science. So within that, they created that reopening plan that we opened at the end of September as like our first trial of hybrid learning. And we opened, which is very similar to public schools in this hybrid model. And basically what the hybrid model is it's in cohorts. So we split each class into two, and the cohorts come in on certain days. So cohort A will come in on Monday and Wednesdays, and cohort B will come in on Tuesdays and Thursdays. And then when they're not in, they're at home, and on Fridays, everyone is at home. And of course, which was probably predictable, not some kids also opted to stay virtual all the time. So our cohorts got really small to the point where I had at most 9 kids in my class, which if I had to take away one benefit from this whole entire situation is the ability to have a class size of 9 kids. I always think that like schooling should have that size because it just allows you to have more one-on-one time with kids, differentiate learning to fit the needs of the scholars actually in your room, because having any more than that, you can't really individualize learning like that. So if I could say any of the benefits, it would have been that.
That's the silver lining of this entire situation.
Yeah.
I wanted to ask also, I'm glad that you mentioned, I'm super interested in learning about the curriculum and the anti-racism and abolitionist work that the school is also teaching students. Can you tell me about some of the lesson plans that the kids have received throughout this school year, especially with everything going on with COVID-19, all the protests that are happening, Black Lives Matter movements?
Yeah, so we've actually been doing a lot. If you walked into my classroom, all of the kids can tell you their opinions on what's happening in the world. A big thing is right from the beginning, we created these blocks for social emotional learning that always had, with first grade in general, you always do like the kindness and the community building. But right now, that is just so much more important to have like a home place. And our school has a really big emphasis on this home place as some place where you can not only feel comfortable coming to, but you can also feel comfortable being yourself in. So that's been a huge part. We've done a lot of activities with identity. We've done a lot of activities with the election. The kids really got to understand what the Electoral College was and how that was working. We talked a lot about when the election wasn't actually over yet and what that means, that all votes need to be counted and everyone's voice need to be heard. We talked a lot about voting rights and how, you know, it may be a right, but people had to fight for it. And it hasn't always been a woman can vote or a Black person can vote. It's really that had to be fought for. So we talked a lot about leaders of those movements. The kids get really into it and they love sharing their opinion and having discussions with each other because they all come from different backgrounds and they hear what their families talk about. So they bring that into the classroom. And it's just a really great way to express their feelings and learn from each other, and also just learn how to ask questions and get into debates with each other about things that they feel very passionately about. So you just have a bunch of 6-year-olds just kind of going back and forth, and it's great.
I was just about to ask you, how old are the kids? 6 years old. Wow.
Yeah, 5 and 6. Yeah. But they are just so interested and curious, and they're just like sponges sucking up the world around them. So I feel the best thing that we can do as educators is give them a space to ask those questions and challenge those norms that, I don't know about you, but I never had that opportunity as a kid to do. It was always like, this is the academics, this is the curriculum, you're just going to learn this. Whereas now we want them to be just as much a part in their academic as we are as their teachers.
Yep, I had the same experience. There was no place for a kid to, give an opinion or raise their hand when it comes to this type of thing. It was just like, this is the rhetoric you have to, understand, and like, you're a kid, stay in your place. So I love that that's happening, and the future is bright as East Harlem scholars. So thank you for sharing.
Yeah.
Emma, before we go, how can families find out more about the school, and just any numbers or websites that you can provide at this time?
Yeah, so we definitely have an Instagram. It's EHTP NYC. So you can check that out for all of the information on open houses and things like that. And we also have a website. So eastharlemscholars.org has all of the information about our policies, our charter, our anti-racist practices, all of that stuff is on there as well. So that's all the places you can reach us.
Thank you so much, Emma, for your time today. Thanks for joining us.
Of course.
Emma Sprecher is a teacher over at East Harlem Scholars Academy II, and you can learn more about the schools visiting them online at eastharlemscholars.org. We'll be right back.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently, learn more ways to protect yourself and others at coronavirus.gov.
Welcome back. With COVID-19 cases surging, thousands of New York City residents fear the risk of eviction. And while court hearings are still relatively low, Mobilization for Justice recently confirmed that marshals are serving eviction notices in New York City and upstate. Joining us now to share more is Justin Mort, supervising attorney at Mobilization for Justice, Inc. Welcome. Thank you so much for joining us today, Justin.
Oh, well, thank you for having me.
Of course. So first, just to start, can you tell us a little bit about Mobilization for Justice and your mission?
Absolutely. Mobilization for Justice have been serving New Yorkers for over 50 years. We are a nonprofit legal service provider who tries to ensure that there is equal justice for all. And we do that through policy advocacy, impact litigation, providing free legal services to New Yorkers across the city.
Thank you so much, Justin. And what eviction protections do tenants still have during the pandemic? I know that there's a lot of information going around. Is eviction moratorium still in practice right now? What are some of the protections that people still have the right to as tenants in New York City?
Great question. So this is a question I get asked a lot, and it kind of changes week to week. In New York, the eviction moratorium ended on October 1st through the court system. So at the moment, the only protections left for New Yorkers are the Tenant Safe Harbor Act that was passed in Albany over the summer, which protects tenants who lost money during COVID, and then Governor Cuomo's executive order that expanded that to tenants who have suffered a loss of income but are in a non-payment or holdover case regardless of when that happened. But those are very limited protections. And if you are facing housing court cases, you should probably talk to an attorney to see if you may be able to use that defense.
Thank you, Justin. And the city recently reported that the first legal residential eviction in the city since March took place recently on November 20th. Can you please share what happened with this tenant?
Absolutely. So this was a very sad case of a 20-year tenant who lived with her elderly father, her daughter, and her 1-year-old grandchild. She had a court case that was going on before the pandemic started, and they reached a settlement agreement. The landlord alleged that the settlement agreement was broken and then sued to evict her, and unfortunately was successful. And so she lost her home.
Oh, that is just awful, and especially during a global pandemic. I hope that she's doing okay and that she found another home to live in at this time. But what exactly does this mean for other tenants, Justin? Like, should people be worried about this happening to them? And what does Mobilization for Justice foresee happening with other tenants at this time?
Well, there's a lot of fear. Housing court currently has around 200,000 cases, and all those cases, predominantly 95% of them, are landlords trying to evict tenants. There are limited protections, though we hope that Albany and Washington, D.C. will strengthen those, but there's a lot of people now who are scared and behind rent because they lost their jobs from COVID-19. So as of right now, there's been very few legal evictions. Those have been many illegal evictions and people forced from their apartment because their apartments were found unsafe by the city. And what we're recommending is that people do not have to leave their apartment unless there's a court order. And if you do get papers from the court, that you should talk to an attorney and find out what your rights are.
Got it. Thank you. And let's say someone is listening right now and they need assistance. What number can they call for Mobilization for Justice to provide that assistance at this time? I know you're going to provide that at the end, but just in case people are tuning in right now.
Absolutely. Our hotline for Bronx tenants is 212-417-3889, and we have it open every Monday and Wednesday where people can talk to an attorney from 9 to 5. Tenants can also call other organizations because there's a lot of tenants in this boat, such as Housing Court Answers, the Housing Court Justice for All, or the Right to Counsel Coalition. They do a lot of great work in the Bronx, and they help tenants organize so they can use their collective power because they're not alone.
Perfect. Thank you so much. And just so I understand the process that Mobilization for Justice has when helping a tenant stop eviction from happening, how does that go? How does Mobilization for Justice mobilize in order to help a tenant that is at risk of being evicted?
It really just depends on the person's individual case. As of right now, it's deemed too unsafe for people to go into housing court physically. But unfortunately, the city has not found it too unsafe to evict people. So if people are getting court papers, we'll discuss it with our attorneys and try to figure out what's the best course of action for the tenants and their family to make sure that they can achieve their goals, which usually is trying to keep their home.
Got it. And I know another concern, Justin, is that if people people have been lining up at housing courts here in the Bronx in particular. What is the risk? Can we talk about the risk of COVID spreading at these housing courts as well?
It's a real danger. Brooklyn alone lost 2 or 3 judges who were at the Kings County Supreme Court. There was a report today that where the Brooklyn Housing Court was taking place in the criminal court, that several people came down with COVID-19. And earlier this week, there was a report by medical professionals in UCLA that was looking at eviction moratoriums and the spread of COVID. And it was estimated that around 10,000 people probably caught COVID and passed away related to evictions across the United States directly. So it's a real threat. We need to be sure that people can stay at home, and you can't stay at home if you're homeless. So it's incredibly important that our city, our state, and our federal government take action to make sure that these tenants who have done nothing wrong are able to stay in their homes where they can keep safe until we have a cure.
Thank you, Justin. And let's say, what can a tenant do if a landlord files a petition to evict them at this time, at this moment?
Absolutely. So if someone gets a petition, the tenant then is expected to respond to that petition. The petition is the paper that starts a court case. What I recommend is that the tenant reach out to an organization like my own, Mobilization for Justice, or to any other of the legal service providers. And they can find those by just calling 311 and saying, I'm being evicted and I need help. And you'll be provided a list of attorneys who can help them. We're all in it together, and we just want to make sure that people get the help that they need.
And Justin, can you just tell us about some of the asks and some of the demands that an organization such as yours is making at this time for Governor Cuomo and for also Mayor Bill de Blasio to take into consideration the many tenants, especially here in the Bronx, who fear eviction at this time?
That's a great question. And I think there's a lot of things that we could do better. First off, the city or the state put out $100 million to help tenants, but they only gave out $40 million. And they denied over 60,000 tenants who applied. So first off, we need to make sure that $60 million is spent, because if it's not spent helping tenants, we lose it back to the federal government. Secondly, we should have a full eviction moratorium. If it's not safe for high schoolers to go to class, if it's not safe for lawyers to go to court, then it's not safe for tenants to be evicted. And so we should have an eviction moratorium until it is safe for people. And then lastly, there's several bills up in Albany that would make a big difference. And that includes creating new rent subsidies, that includes canceling rent, among many other things. And the Housing Justice for All Coalition has a great website detailing what those policies are. And then lastly, we need a federal government to step in and take action. $1,200 that they did back in the spring helped, and it helped a lot of people. But it's been months and people are suffering. Jobs are still gone, rents are still needing to be paid. So we need action by President-elect Biden and the rest of Congress to make sure that New Yorkers and tenants across our country are able to stay in their homes and that people are able to pay their mortgages. And so far we've seen very little action. So I hope that we see some change on the horizon.
Before we go, Justin, would you be able to just share a few words of ease or a message of ease for tenants who may be getting evicted or who may be fearful at this time?
There's a lot of fear, but you're not alone. There's tenants across this country that are having the same fear. But in New York, you have protections, you have rights. You cannot be evicted if you lived in your home for more than 30 days without going through court. So don't leave just because someone tells you to. You don't have to leave until a court order. And I will say that my office has been very successful to stop those court-ordered evictions. So it's really important that you talk to an attorney who can explain to you your rights and help you achieve the best result possible, because we want you to be safe and we want you to remain in your home.
Thank you. And before we go, can you just provide that number and all the information just in case someone needs it once more?
Absolutely. Our Bronx Tenants Hotline, which is every Monday and Wednesday, is 212-417-3889. And feel free to call. We have attorneys manning that hotline every Monday and Wednesday.
Thank you again, Justin, for your time today.
And thank you for having me. And I wish you guys the best of luck.
You as well. Justin Mort is the supervising attorney at Mobilization for Justice, Inc. They're open Monday through Friday, 9 a.m. to 5 p.m. So if you're a Bronx tenant, you can call 212-417-3889. If you're tuning in Manhattan Neighborhood Network, you can call their Manhattan hotline at 212-417-3888. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always.